notice that I ain't going nowhere. I ain't blowing no smoke. I mean, I've been sober, but you should've known it. I wasn't going.
Hello guys, welcome back to my channel. Welcome back to another video. It's your RN Steph. So today guys, I'll be presenting on Polycystic Ovary Syndrome like I promised. On previous videos I did diabetes and high blood pressure as requested. So I also got a request to do a video on polycystic ovaries, so this video will be about that. But before we go into the video guys, remember to like, share, subscribe, and to leave a comment in the comment section of the video if you have any feedbacks or if you have any topics that you would like me to present on. You can leave a comment and I'll make a video about that. Right, so polycystic ovary syndrome, what we call PCOS, is a common condition that affects our woman's ovaries work. Now, the ovaries are the two almond-shaped organs located on either side of the uterus. They are responsible for producing and releasing eggs. Polycystic ovary syndrome is one of the most common hormonal disorders affecting women between the ages of 15 and 44. The three main features of PCOS are irregular periods, which means your ovaries do not regularly release eggs, what we call ovulation. Excess androgen, so high levels of male hormones in your body, which may cause physical signs such as excess facial or body hair. And then the other feature is polycystic ovaries. Your ovaries become enlarged and contain many fluid-filled sacs or follicles that surround the eggs. But despite the name, you do not actually have cysts if you have PCOS. So to recap, the three main features of PCOS are irregular periods, excess androgen, and polycystic ovaries. So if you have at least two of these features, you may be diagnosed with PCOS. Polycystic ovaries contain a large number of armless follicles that are up to 8 millimeters in size. The follicles are underdeveloped sacs in which eggs developed. In PCOS, these sacs are often unable to release an egg, which means ovulation does not take place. It's difficult to know exactly how many women have PCOS, but it's thought to be very common, affecting about 1 in every 10 women in the UK. More than half of these women do not have any symptoms. What are some of the symptoms of polycystic ovary syndrome? If you have signs and symptoms of polycystic ovary syndrome, they'll usually become apparent during your late teens or early 20s. So signs and symptoms include heavy periods or no periods at all, difficulty getting pregnant as a result of irregular ovulation or no ovulation, excessive hair growth, usually on the face, the chest, the back or buttocks, weight gain, thinning hair and hair loss from the head, oily skin or acne. PCOS is also associated with an increased risk of developing health problems in later life such as type 2 diabetes and high cholesterol levels. But what causes polycystic ovary syndrome? The exact cause of PCOS is unknown, but it often runs in families. It's related to abnormal hormone levels in the body, including high levels of insulin. Insulin is a hormone that controls sugar levels in the body. Many women with PCOS are resistant to the action of insulin in their body and produce higher levels of insulin to overcome this. This contributes to the increased production and activity of hormones like testosterone. Being overweight or obese also increases the amount of insulin your body produces. Alright, so other symptoms include male pattern baldness or thinning, ear thinning. Right, so people with PCOS are more likely to have other health conditions, including type 2 diabetes, as I mentioned before, heart disease, endometrial cancer, that is cancer of the inner lining of the uterus, and high blood pressure. PCOS can also cause anxiety, depression, and a negative body image. Some symptoms such as infertility, obesity, and unwanted hair growth can lead to social stigma. This can affect other life areas such as family, relationships, work, and involvement in the community. So we're now going to the diagnosis, how you get diagnosed with polycystic ovaries. So polycystic ovary syndrome is diagnosed by the presence of at least 2 out of the following factor features, like I mentioned before. So signs or symptoms of high androgens, that's like unwanted facial or bodily hair, loss of hair from the head, acne, or an elevated blood level of testosterone. After other causes for this have been excluded. 2, if you have irregular absent menstrual periods after other causes for this have been excluded, and the polycystic ovaries on an ultrasound scan. So if you have 2 of the following, they'll diagnose with polycystic ovaries. Blood tests can be used to identify characteristic changes in hormone levels, although these changes are not universal. Women with polycystic ovary syndrome have elevated levels of testosterone and ovarian androgen hormone that influence hair growth. They have elevated levels of estrogen and ovarian hormone that stimulates growth of the womb lining in endometrium. Luteinizing hormone or LH, that's a pituitary hormone which influences hormone production by the ovaries and is important for normal ovulation. Insulin, they also have elevated levels of insulin, a hormone that is principally involved in utilization of energy from food, and an anti-Mullerian hormone, which measures the fertility level of the ovaries. So when making a diagnosis, doctors also take into account that irregular periods and ovulation can be a normal part of puberty or menopause. Having polycystic ovaries may run in families, and women with a family history of PCOS or type 2 diabetes are at higher risk of PCOS. In addition, the ultrasound picture is not always clear, and some women with PCOS may have an ultrasound scan that does not demonstrate polycystic ovaries. So now we are going to go into treatment. First off, there is no cure for PCOS, but treatments can improve symptoms. People who have irregular periods, trouble getting pregnant, or excessive acne and ear growth should speak to a healthcare professional. Some symptoms of PCOS can be reduced through lifestyle changes. Eating a healthy diet and getting enough exercise can help reduce weight and reduce the risk of type 2 diabetes. Birth control medicines such as contraceptive pills can help regulate the menstrual cycle and reduce symptoms. Other medicines can reduce acne or unwanted hair growth by PCOS. Treatments for infertility due to PCOS include lifestyle changes, medicines or surgery to stimulate the regular ovulation. In vitro fertilization, IVF, may be used, but it has some risk. Also, if medicines are not effective, a simple surgical procedure called a laparoscopic ovarian drilling, LOD, may be recommended. This involves using heat or laser to destroy the tissue in the ovaries that's producing androgens such as testosterone. With treatment, most women with PCOS are able to get pregnant, right? So there are several well-known celebrities that have spoken publicly about their experiences with polycystic ovary syndrome, including Keke Palmer, and we can see that she had a son the other day, so there are good experiences as well from persons that have PCOS. They actually produce children. We have Julianne Michaels and Victoria Beckham. So that is it on polycystic ovary syndrome. Like I said, there's no cure for PCOS, but the symptoms can be treated. So you speak to a healthcare professional if you think you may have the condition, and if you have PCOS and you're overweight, losing weight and eating a healthy balanced diet can make some symptoms better, but you know, it's easier said than done. But anyway, I still have to endorse losing weight and eating healthy. You may find some persons that would give their experiences with PCOS would tell you that they have been trying for years to conceive and they're not able to, and some will tell you that they had no problem conceiving with the condition. So I guess it's all based on the person, and you can see the healthcare professional to get your symptoms treated so that you can improve ovulation, and you can speak to them about advice as to what you can do to conceive. So thanks for watching my videos. Remember to like, share, subscribe, leave a comment in the comment section down below. It's your RN Steph, so see you in the next video.